good. How's it feeling? Working hard? Yeah? So we're gonna let Grace sit here for 5 minutes. What's up, everybody? This is Dr. Brady from Kalkstein Chiropractic, and I'm here with the one, the only Grace Dietz. Grace here, I've been working with her for about a week, since last Tuesday? Mm-hmm. Tuesday? Okay. So Grace, why don't you tell the audience here what happened last Monday?
So I was hanging out with a couple of my friends, and I went to go jump during one of the discussions that we were having, and I was trying to show them. And when I came down, I made impact on the ground, and then my kneecap came out of its track, and then I fell to the ground, and then I got pushed back in, and now we're here.
Now we're here. And it's been in ever since. Right?
Yeah, thankfully.
Yeah, okay. So, has this happened to you before? Or is this your first time?
So I've had a history of patellar dislocations in my other leg, and this is the first time that it happened in my right leg. So.
Yeah, gotcha. Okay. So what we've been doing here so far with Grace is really we want to stabilize for these lateral patellar dislocations here. So I'll show you the tape job that we do here with Grace today. But we've been stabilizing it. I gave her a few active care exercises. She's done pretty well, pretty consistently too, right, Grace?
I think so, yeah.
Okay, good. We're going to ramp her up here a little bit today too, adjusting the whole posterior chain, and also doing some dry needling as well. So today I'm just going to adjust the posterior chain, show some soft tissue work that we do to the affected muscles, and then give her some new and improved exercises for today. So we'll get started here, and I'll bring the table up here, Grace, and we'll go face down. So what do you think of Maryland weather where you get 4 seasons in 1 week? Literally Saturday it was 70 something degrees, 70 degrees, and today it's like 26 this morning.
Funnily enough, that's something both a Marylander and a Pennsylvanian would say.
Yeah, that's true.
Yeah.
Any pain here today, Grace?
Nope.
No, all good. Alright, so give me a nice deep breath in, all the way out, relax those shoulders, yep, good. Then on your side, facing me here, please. So right now, you're on the injured reserve, right? No dancing for you for right now?
Unfortunately, that class has been put on pause.
Put on pause, okay.
Yeah.
I'll roll you right through here. Yeah, it's going to be a slight drop right there. Yep. And then same thing on the other side. Walk me. I talk about them every single YouTube video, so shout out to those Steelers for getting that 20-10 victory over the Saints. Yep. And then on your back here for me. Alright. So I'm obviously not going to do a long axis traction on Grace's knees here, just because it's still a little unstable working with the exercises and getting there. Just going to give it some time here. So do the other side, and then I'm also going to do some soft tissue there. And Grace is going to help me out here by adding movement as I'm pinning down and stretching the muscle here. Are you having Thanksgiving at your place, Grace? Are you going to make the turkey?
Yeah, I think I'm in charge of the German potato salad, actually.
German potato salad?
Yeah.
Okay.
Have you ever had an unconventional Thanksgiving? Really?
What's that?
Where you do foods that you don't usually do at Thanksgiving?
No.
Like pizza?
I've never done that, no. It's a pretty cool idea. Have you done that?
Yes. I would recommend at least once, if you have a chance.
I'll keep that in mind. I mean, Thanksgiving food is not the best food anyway. I mean, turkey's kind of dry, you know. I mean, sweet potatoes and mashed potatoes, yeah.
Yeah. Could always get down some good sweet potatoes.
For sure. Especially when you add the marshmallows on top. Alright, so just keep doing that same motion here. So starting point's right up here. And then you're going to bend your leg towards the back. Yep. I'm slowly going to work to that muscle that's affected over here. Yep. Still doing okay with the pressure? Just trying to gauge it by looking at your face here and your body language. Good. So the muscle that's affected here, typically with the lateral dislocations, and that makes up most of the knee dislocations here, is the VMO. So the vastus medialis here. When it gets weak, I'm not saying you're weak, Grace, at all. When it gets weak, it doesn't hold that knee, the patella, in where it's supposed to. So that's why you have that lateral shift. So we've been giving Grace so far some pretty basic exercises. She's pretty strong, but we'll show you those active care exercises that she's been doing here early on in her treatment. So I'm going to place this roll right underneath your knee here, Grace. All I want you to do is just try and crush this roll. Right there, yep. And then relax. Give me 2 more good ones like that. Really push that down. Good. Relax. So what this is doing is just contracting the quad here. And then release and just strengthening those muscles. Good. Alright. And I'm going to bring that up. And the next exercise that we gave her early on in the treatment process was the leg lifts. Now it's not like your typical leg lifts here. We really want to focus on that VMO muscle, the most medial quad. So we're going to turn that foot, yep, Grace already got a 45-degree angle, and you're just going to start doing leg lifts. Yep. Good. You can even challenge it a little bit. Good. Awesome. How'd those feel? Pretty good?
Okay.
Ready to move in?
Let's go.
Yeah? Too easy for you now?
Yeah.
Okay, let's do it. So I'm also going to show you how we tape a knee here as well. I'm just going to wipe this off here. Swelling went down a lot.
Yeah.
Don't make fun of my tape cutting skills, please. They're not that bad around it.
Oh.
Do that? Yeah. We're getting there.
Solid rounding. Yeah, I'm grateful that one of my legs doesn't necessarily look like the Michelin Man anymore. Not necessarily a real swell time, you know. Move on.
Yeah, okay, yeah, back to this knee thing over here. I don't even know how to react to that, honestly, but... Alright, so what we're going to do, this is the knee, just to give that a little bit extra support here. I'm walking here. Alright. So I'm just going to take the tape on both sides of the quad here. So I'm going to start pretty high up here, proximal. Go all the way down. Just like that, right to that anchor point. Good. See that they have Christmas commercials out already?
No.
I swear.
No.
They do. They're even playing Christmas music. I wish I was lying to you.
Every year.
Every year. Gets earlier and earlier.
Yeah.
You don't watch Hallmark movies, do you? Are you serious? They're like the same. They're like the same every single time.
You know what?
It's like
though?
a girl meets a guy, and then they have Christmas and magically move.
Sometimes you just want to leave your like busy city job and go to the country.
Exactly. Yeah.
Leave your boyfriend of 14 years and go date a guy that's wearing flannel and knows how to bake an apple pie. Okay. Come on. Who doesn't want that?
And then have a reindeer as a pet. Alright. So that's basically how we do a knee taping job, just to give that extra support, especially with these new exercises that we're going to show Grace here today. Just make sure everything stays nice and tight and in place there. So, ready to exercise, Grace?
Let's go.
Let's do it. Alright, so back everybody to doing some extra active care exercises for that lateral knee dislocation. So what I want Grace to do here is keep this ball right between your knees. What this does is it activates your hip adductors, adduction, as some people would like to say, and strengthens and really targets that vastus medialis. So we're going to go all the way down to about 90 degrees here. Nice. And just sit right here. And just chill, read a newspaper, whatever you want to do. You should feel that in your knee. If it's too much for you, let me know, and we'll make some alterations. Yep. How's it feeling? Working hard? Yeah? So we're going to let Grace sit here for 5 minutes. Let's give it 10 more seconds. 6, 5, 4, 3, 2, 1. Good. And relax. Yep. And typically we do 2 sets of 20 to 30 seconds, depending on the severity of the injury and a couple other factors here. So what we're actually going to do, I'm going to take the ball here. We're going to go onto our backs. So same position here. Ball's going to be right in between your knees. And we're going to bridge up, just like that. And bridge up, keeping that tension in the ball.
I realized I got it set up before I even.
Yeah, it's all good.
Okay.
Good. And again, we do 2 sets of 10 here. In addition to the starter exercises that we gave Grace. So I'd like to have about 4 exercises for her to do throughout the day. And judging on how she does with these exercises, we might ramp up and give her a few more. But we'll see how she feels tomorrow, see if she's sore. And then you can relax. Nice. Good work.
Thank you.
Awesome. Any jokes before we end the video here?
Rehab.
Rehab. All right, and comment below your favorite Christmas movie. All right. All right, thanks for watching, everybody.